Good afternoon. Thank you for the briefing. Emphasizing again today in the information we're being given of the problem in northern and northeastern British Columbia. BC Hydro reported last week it's had 2 major outbreaks at Site C this year, and the majority of the cases were among the unvaccinated. Hydro also says that a significant share of its workforce rotates in and out of British Columbia from Alberta. Should Hydro be making it mandatory to be double vaccinated to work at Site C as a way of helping contain the problem in northeastern BC?
The short answer from my perspective as Provincial Health Officer is absolutely. Yes. We have been working with my teams in Northern Health, the public health teams. Dr. Jung and Jung Kim and our team have been working with Site C all along. We had some challenges with a number of the large industrial camps over last winter and put in measures and worked with them. They have very strong medical support on site now and have had for the last year. But yes, these continue, and it started in the summer. We've had reports from Northern Health. We've put in additional orders for the industrial camps that require reporting of vaccination status of workers, but it's not high enough, and that is contributing to some of the surge that we're seeing in communities. It's also contributing to challenges in workers becoming sick, particularly in the congregate living settings that they're in the industrial camps. So I have written a letter to all of the employers in the large industrial camps, particularly in the north, saying that it is my very strong recommendation that they make it a requirement, particularly of living in the communal living settings that they have in the industrial camps.
Yeah, just to add on, because the detailed information gives a sense of that, there was an outbreak declared on August 18, 2021 at Site C. There are currently 15 active cases at that outbreak. The situation is stable. Just so we understand, 3,575 doses have been administered on site. That's 1,985 first doses and 1,590 second doses. The immunization rates of the workers, of the 2,000 workers reporting to date, is 83% fully vaccinated, 7% partially vaccinated, 5% unvaccinated, and 5% not disclosed. We've been making progress there. And as of October 1st, there are 1,687 workers in camp. The short answer is we're encouraging everyone to go this route. It's important. And obviously, Crown corporations are not the public service, as you'll understand, but we're encouraging everyone in BC to get vaccinated and encouraging our leaders in BC, whether in whatever part of the business sector, public or private, to encourage these efforts as well.
Vaughn, do you have a follow-up?
Yes, please. You've said several times that employers have a right to make vaccination a requirement to work. Where employers have not done that, how much leeway do employees have to refuse to work alongside the unvaccinated?
Yeah, I'm not sure I'm qualified to answer those questions, I'm afraid. Those are part of labor relations and labor laws. I know there is good advice that WorkSafe BC has put up that the Ministry of Labour has pulled together for employers to answer those specific questions. But it is an important consideration. You do have a requirement to have a safe workplace. And what we're seeing right now with the strain of the virus that's circulating is it can be transmitted very rapidly. And that risk goes down dramatically when everybody in that setting is vaccinated. So it is an important worker safety issue. But for the technical advice on how that plays out within an individual workplace, I refer people to WorkSafe BC. They have some great information there for employers.